So I'd like to say hi to everybody that's watching this video. And today we just want to talk about COVID-19 vaccinations and provide some information, particularly to those that are in aged care, the residents, their families and the staff, and also to anyone that in fact is over 70. So I'm Chris Ferlazzo from Northwestern Melbourne PHN. And today we have Dr. Wendy Bamberg, who will be providing us with lots of information. So Wendy is the medical lead and physician at the Western Public Health Unit. Wendy's recently moved from the United States, where she's worked in public health since 2005 and focused primarily on the prevention of infections in healthcare settings and in aged care. So welcome, Wendy.
Great, thanks for having me today. It's a pleasure to be here.
So let's start. We're just going to have a chat, some questions and answers. So tell me, Wendy, how good are COVID-19 vaccines against infection?
Yeah, so it's important to understand that a lot of what I'm going to be talking about today really relates to the protection against Omicron. So Omicron is the current type of COVID-19 that's circulating right now. So we can look at how vaccines protect against infections with symptoms, severe infections, including being hospitalized, and also against dying. So as an adult, a third dose will double your protection against infection and transmission compared to having only 2 doses. But if you're 65 or older, it more than doubles your protection. And it also gives increased protection against hospitalization and death, increasing the effectiveness of that vaccination from around 60% to around 90 to 95% when a third dose is given. So it's really important to get that third dose.
Now you talked about hospitalizations and dying. So who's most at risk of for being hospitalized or dying from COVID?
Yeah, age is the largest risk factor for COVID-19 hospitalization or dying from COVID-19. So persons who are 80 years and older are 28 times more likely to be hospitalized than someone who's in the age range of 15 to 19, even when controlling for other things like medical conditions. So other people who are at risk include people who are immunosuppressed, so their immune systems aren't working quite as well, including people who might be on certain medications that impact their immune system, people who have undergone transplants, people with cancer. All of these folks are all at high risk. Pregnant persons are also more at risk, and other medical conditions like diabetes, neurologic conditions, respiratory diseases, heart conditions can all increase the risk of severe outcomes. So if you have questions about your particular risk for severe disease with COVID-19, your healthcare provider is a really excellent resource for you.
There's a lot of talk now about boosters or third doses. So why aren't 2 doses enough? Why do we need a third dose?
Yeah, that's a great question. So data for these vaccines show that they are extremely effective, as I mentioned, at preventing severe disease, including being in the hospital and dying. However, current data also shows that the vaccine's ability to prevent infection or severe illness decreases over time. And this is especially true in people who are 65 years and older. So compared to someone who is unvaccinated, you're much less likely to die or be hospitalized if you've had those 3 doses of vaccine. So for example, someone with 3 doses is between 20 to 80 times less likely to die of Omicron and around 10 times less likely to be hospitalized compared with someone who has never received vaccine. So it really is important to get that third dose as our immune systems are waning from those 2 doses that we got earlier.
Are there other benefits that the vaccination can offer for protection?
Yeah, absolutely. I think it's often not talked about that vaccines seem to protect against long COVID, which is a condition that can result in symptoms that remain for weeks or months after COVID-19 infection. And that's really important to protect against. Additionally, for children, vaccine protects against a rare but serious condition called MIS-C, and it typically happens about 2 to 6 weeks after COVID-19 infection. And I think another thing that people sometimes forget about is that being less likely to be infected due to vaccination means that you're also less likely to transmit the virus to others. So even if you might not be at risk for these things, others around you might be. If you're a worker in an aged care facility or you're a family member of someone who is at an aged care facility, being up to date on your vaccinations, which includes that third dose, means protecting the most vulnerable members of our families and the aged care communities that we're a part of.
So we know that there's been a lot of COVID-19 around. And, unfortunately, we've had residents in aged care facilities and staff who've been infected and have been COVID positive. So why is it necessary to have a vaccine even after you've had COVID?
Yeah, this is a really good question, and we continue to learn more all the time about how our immune systems react to COVID-19 infections and how our immune systems respond to vaccination. So people who've been infected with COVID-19 and get vaccinated have really strong immune responses after vaccination. So getting that vaccine will boost your immune system again, even if you've had infection before. We don't know how long our immune systems will remain effective after an infection. And the likelihood of being infected again, so reinfection, is reduced if you're vaccinated after being previously infected. So there was one study that came out recently that said that those folks were more than 2 times less likely to be reinfected if they had had vaccine after having infection as opposed to just having an infection alone. So it's really important for those folks to also get vaccinated.
So for the people that have had COVID, but they've only had 2 doses, how long after having COVID should you get your additional dose? Or in fact, even a first or second dose if you haven't had that, in fact.
Yeah, so ATAGI, which is the Australian Technical Advisory Group on Immunization, so long name, but it's pronounced, or its short version is ATAGI, easier to say. They recommend waiting to get vaccinated if you're sick with an acute illness, including COVID-19 or other infections. So this is general practice with all vaccines. It's not special to COVID-19 vaccine. And one of the reasons is so we can separate out any symptoms from the illness that you're having at that moment from any side effects of the vaccine. We also want to make sure that your immune systems are good and ready to go when you get vaccinated. You can get the COVID-19 vaccine and other vaccines such as the flu vaccine as soon as you're recovered. You can also choose to wait for up to 4 months after the infection to get your COVID-19 vaccine if you choose to do that, and that's per those ATAGI recommendations.
Okay, so I can get it as soon as I'm well after having the infection, or if for some reason I want to wait, I can wait a bit longer.
That's right. And in aged care facilities, we really do want folks to have that third dose and to be vaccinated. And so even though, some people can choose to wait for up to 4 months, that's not our typical recommendation in aged care facilities. We really want people to get vaccinated as soon as possible. So as soon as staff members or residents are recovered from that acute illness, and if they haven't had their booster or they haven't had their primary series of vaccine, we do want them to get vaccinated as soon as they possibly can.
So in Australia now, there's a few different types of COVID-19 vaccines. So does it really matter which one I have for my third dose or my booster dose?
Yeah, that's a great question too, and it does get a bit complex. So you're right, there are many different vaccines right now. We have Pfizer, Moderna, Novavax, and AstraZeneca. And so for the primary series vaccines, we'll talk about that first before we get to the boosters. If you are less than 60 years old, it's preferred that you get Pfizer or Moderna, which are the mRNA vaccines, or Novavax. For people who are pregnant, it's Pfizer or Moderna, although Novavax can also be given to pregnant people as well. Now, for the third dose, which includes those booster doses, for people who are 16 to 17 years old, Pfizer is the only vaccine that's registered for use, so it's important to note that. But for adults 18 years or older, it's recommended that Pfizer or Moderna are really those preferred vaccines for the third dose, no matter what vaccine you received for your first 2 doses. There is a note also that AstraZeneca or Novavax can be used for a third dose if Pfizer or Moderna isn't available for some reason. That is also an option.
Now, we're in March, but we're coming into the flu season. So and I want to have my influenza vaccine or my flu vax, can I have, and say I'm due for a COVID one as well, can I have them on the same day?
Yeah, we're finding out more information about this, and this is a great question. And absolutely, you can have them on the same day. COVID-19 vaccines can be given at the same time as an influenza vaccine, which is, I think, a great relief to people when they're going in to get their vaccines around now. They can get both. Studies have shown this is safe, and both vaccines are effective when they're given together. So definitely go out there and get your influenza vaccine. And if you haven't had your COVID-19 vaccine, do that as well at the same time.
So now, Wendy, this is a little bit different to what happened last year, because when we were rolling out the COVID-19 vaccine in our aged care facilities, we had to wait 2 weeks between having a COVID vaccine and a flu vaccine. So why is it different this year?
Yeah, that is a very great point. We didn't really have the data last year to determine if the vaccines would still work as well if they were given together. So now we've got a lot more data, and we have information that these vaccines are safe and they work just as well when given together as when they're given by themselves.
Okay, so that was going to be my next one. So now, if we're going to give them together, they'll both work as well, and they'll both be as safe.
Yes, absolutely. So several studies have been done that have shown that the body's immune system works just as well when COVID-19 and influenza vaccines are given on the same day. Those same studies also demonstrated this is safe with similar side effects if these two vaccines were given either separately or together. And I just want to note that it's very important to get your influenza vaccine this year. We expect with borders open and people interacting more that we're going to see more influenza this year. An influenza vaccine protects against severe infection, including going to the hospital or dying, and protects you from spreading it to other vulnerable people around you. And this is really important, again, in aged care facilities where the residents can be very vulnerable. And just to note that vaccines for influenza are expected to be available this month in March of 2022.
So that's probably all of my questions. Wendy, is there anything else that you wanted to let us know, or anything that you wanted to highlight today?
Yeah, so I think that, given this is a vaccine conversation, I just want to say again how important it is to stay up to date on all vaccines you're eligible for. And that includes COVID-19 vaccines, influenza vaccines, or any others that you might be eligible for. And it not only protects yourself, but it protects others around you that might be more vulnerable to these diseases. And I think that's really important to keep in mind when we're talking about aged care communities that we serve.
Thank you for your time today. We at Northwestern Melbourne PHN have been really pleased to be able to work together with the Western Public Health Unit, and this has been a really important conversation, and hope that it helps the people that are listening to this to make some decisions. So thank you very much, Wendy.
Thank you very much for having me. I really appreciate it.